Hey everybody, thanks for tuning in today. In today's video, we're going to talk about the last two parts of the Evidence to Recommendations, or EtR framework. They're known as equity and feasibility. Now, what's important about these two domains of the EtR framework is that they aren't necessarily going to cause a policy not to pass, but rather they're going to inform how the policy is worded, or they may be the difference between a choice. If there are a few policy choices being considered, they may inform leading towards one rather than another. So what are equity and feasibility in terms of this framework? When we think about equity in terms of the EtR framework, we're really thinking about, would this policy disadvantage certain subgroups of the population? Or conversely, are there certain subgroups that would require specific ways of implementing this recommendation such that it would reduce inequities? Feasibility focuses on the implementation issues themselves. So, for example, would this policy cause undue financial barriers for either patients or healthcare providers or health systems at large? What is the ease of adding the policy to the flow of clinical practice? What is the complexity of the policy that's being considered? And who are the array of individuals who would be able to give this vaccine? So again, these aren't going to necessarily stop a policy from being voted on and implemented, but they could inform the wording or the choice of one policy over another. So thanks for listening today. Please be sure to check into our final EtR framework video, where we're going to talk about part 3, which are the conclusions. So we're going to be thinking about how does all of the work that we've talked about in these videos leading up to now work to inform the conclusions that either the work group or the ACIP members will make when it comes to policy making. Thanks for listening, and be sure to sign up for our channel so that you know when we post new videos.